Hi guys, good afternoon, and thank you so much for joining us today. I'm just going to let everyone in as they're arriving. Just bear with me 1 minute. We are recording the session, so if you want to keep your cameras off, that's absolutely fine. Fantastic. Okay, so thank you so much for joining us. I will just keep an eye on the waiting room in case any other latecomers do come and join us. But thank you for joining us. I'm joined today with our panel experts, and we're going to be talking about hybrid working and the impact that that may be having on staff wellbeing. So this is our first panel event, so we're super excited that you've come to join us. And what we're going to do is we're going to introduce the panel experts just to talk through who they are, where they work, and sort of what they're involved in this area. And then we're going to go through a series of kind of discussions around this subject that we feel are quite important to kind of expand on. If you have any questions yourself as we're talking, or you come along with any questions that you'd like us to answer, please do use the chat function at the bottom of the Zoom page and pop your questions in there. If the conversation discussion is at that time, I will bring the question in. Otherwise, we'll have some Q&A time at the end. So we're aiming for around 45 minutes with the panel discussing and then a Q&A at the end. Okay, so I'll go first just to introduce myself. So my name is Claire Henson-Bowen. I'm the founder of Bespoke Wellbeing, and we are an occupational health physiotherapy company. So we deliver physiotherapy for staff, DSC and ergonomic assessments, and long COVID rehabilitation. And we've had quite a journey through COVID, from changing from face-to-face clinics into a virtual delivery of care. And we've been working with our customers, looking at supporting them, transitioning very quickly their staff into home workers. And now we're venturing into this new, hybrid model of working. So this is a subject that we're really excited to come and discuss with you today. Okay, I'm going to pass over to Abena now just to say a little bit about herself.
Hi everyone, I'm Abena Bubbers-Jones. I'm an occupational health physician or doctor of workplace wellbeing. So I work with occupational health providers, where we support employees and employers to keep and stay healthy at work, also advising on the legislation, so the health and safety law, the legal side of things as well. So some of the common work we do is receiving referrals from managers on how best to support their employee at work, whether they're at work or off work, such as sickness absence, equality and diversity issues, disability issues, a whole range of different things.
Thank you.
That's what I do in my day-to-day.
Thank you so much. And Claire, I'm going to come to you next.
Okay, thank you. Hello, my name's Colette Owen. I'm a physiotherapist. I've been qualified for well over 20 years, and I work with Claire at Bespoke. So I'm the clinical director at Bespoke Wellbeing. So not only a clinician, but also looking at service delivery and design. So we work predominantly within physiotherapy, but also within ergonomics, so desk assessments and such like. And also I also work within long COVID rehab. So I'm seeing lots of individuals at the moment who are in different stages of perhaps returning to work, whether it be because of injury or ill health, or actually because of lots of transition. So lots of anecdotal experience of what's happening out there.
Thank you. And I'm going to hand over to Jack now, who was Harry but is now Jack.
Yes, so I have replaced Harry today, who is our co-founder and CEO at Champion Health. I'm head of performance, so I hope it's not too much of a drop down having me instead. But Champion Health is a workplace wellbeing platform, and my job is very much preaching and shouting about the link between performance and well-being, something I'm incredibly passionate about, thriving personally so you can thrive professionally. That came from my former life as an athlete. I represented Great Britain at the last 2 Olympic Games, where I finished 4th in London 2012, very close to a medal, something I'm still obviously very bitter about, and thoroughly enjoying watching the Olympics at the moment. I then became wellbeing lead at BBC Studios after being an ambassador for Mind, Young Minds, and working with the government on mental health reform in elite sport and within society. And yeah, that's pretty much what I've done now, and I'm really excited to be able to share some of the stories that we have from Champion Health and some of the experiences we're kind of working on at the moment.
Great, thank you so much, Jack. That's awesome. So for those that have just joined us, just let you know, we're about to start the discussion part of the session today. So if you have any questions as we're talking, maybe you've brought some questions or something that the experts are saying that has sort of brought a question to your mind, can you please use the chat function at the bottom of the page, and then we'll try and weave the questions in, or we'll come to some time at the end. That'd be fantastic. So thank you so much for everyone for introducing yourselves. So we're going to start having a bit of a chat about hybrid working, and we're coming at this, the panel that you have with you today, we've got a medical representation with Abena, we've got Colette who's here from sort of a musculoskeletal element of health and wellbeing, and then we've got Jack from Champion Health who is looking at things. You look at a lot of things, don't you, Jack, but it's sort of start and drive from a mental health kind of arena. So first of all, guys, when we're talking about hybrid working, because this is a term, I think it's a buzzword really, isn't it, right now? It's what a lot of people are talking about. And I think the first thing to do is actually say, you know, what are we talking about when we're saying hybrid working? I don't know who would like to go first. Yeah.
I suppose my understanding of hybrid working is a mix. So it's offering you the opportunity to continue working from home, but also offering you the opportunity to come into an office environment, whether that be something formal, as in a company corporate office, or something like a WeWork type office where you rent out space and come in at certain times. That's my understanding of hybrid. But even within that, I think there's a massive. So 1 week in the office, 1 week out. Some people are coming in ad hoc when they want to or when they can. Others are coming in on like a 1 day a week or twice a week. So it's a massive variation in actually how that seems to be working in practice. So that's my understanding of hybrid. But these guys might have a slightly different definition.
So what do you think about and Jack? There's important points in there that you mentioned, Colette. One is around offering the office and home working. So we've had some discussions previously about, is it set in stone? Like, are people, you must return for these days, or for 2 days a week, 3 days at home, or is it they're giving an option? I think that's a really, good discussion point there. Jack, have you seen anything like that with the stuff that you're doing with Champion Health?
The most common example we're coming across is 2 days within the office, 2 days at home, and then 1 being flexible. So having that choice, that seems to be the one that we're seeing the most. But then every sector is going to be different. Every organisation is going to be different. For example, when I was at BBC Studios, half of our organisation are production. That's a very different thing in terms of hybrid working doesn't exist for that workforce. So it's not something we can just apply to everyone and expect for it to work. So, and I'm sure we'll talk about this later, but that then comes down to finding out the information and supporting our people best. And I think that's what it's got to be. Wellbeing is individual, performance is individual. So we then have to make sure that we're listening and coming up with the best solution for whatever services you're providing or sector you're in.
Have you seen any examples of how people are making those decisions on how many days in the office, how many days working from home? I know you mentioned there sort of the job role and different sort of areas of work. How do employers pick? What is it based upon?
We'd hope it was based upon pretty solid data where you actually speak to your people, but I'm not sure we can always guarantee that's the reason. Sometimes it's someone has just decided, someone who has that power has decided that's what they believe is best. And some organisations will get it right in that respect, but it's not. That's more luck than finding out what your people want. We know the most effective way to have value, bring buy-in, then have that loyalty and that retention with your team is to ask them what they want and then act on it. I remember listening to Gethin Nadin from Benefex, and he was saying the worst thing you can do is ask your people and then not act on it. So I think that's something that's really important. So it's as simple as, there's no point making it more complicated, ask your people what they want. And hopefully you have that kind of that check already with whatever data you might be using, or the conversations through your management, line management, senior leadership, all staff meetings, all team meetings. So yeah, for me, it's, we know how important communication is to well-being, and this is proof that if you want to get the right solution, it's going to be through that communication and conversation that you have.
Perfect, thank you. Abena?
I think for me, but in practice, I see hybrid working as an extension of flexible working. I remember thousands and thousands of times I've had conversations with employers and employees about this person really wants to work from home a few days a week to manage their health condition, or for just other reasons. There's lots of other reasons why people would prefer to work at home or work away from work, I should say. But I guess this, post-pandemic, this is another buzzword that's been attached to it that really describes a kind of permitted norm of doing a certain number of days away from the office. It doesn't have to be at home. Some people do it from from a beach. You could do it from a beach. And I think, now is the time where we're actually kind of proactively recognizing how much we can leverage technology to actually continue running a productive service. And actually, in some ways, it's good that the pandemic has helped us to highlight that, and seeing them in organisations like, for example, the public sector. I'd never thought there'd be a day whereby clinicians were able to do their consultations on the phone or even on video, because that just wasn't done. You were expected as a patient to go in and do the face-to-face, and if you didn't show up, then you didn't show up, and that was it. So I think this has been a really great opportunity, particularly for people who are predominantly office based. Obviously, if you are in a labour sector or a technical sector or a caring sector where you specifically have to be at the point of care or the point of service, then not as easy to arrange. So yeah.
No, exactly. And you raised another good point there, that things have moved very quickly, haven't they, through the COVID pandemic. Things that you didn't think were possible, and maybe some companies where it was like a blanket, no, you can't work from home, suddenly the thing flipped, isn't it? It's like, actually, you have to work from home now, and now it's this hybrid model that's emerging. And a lot of it's been a difficult time, hasn't it, and people not being used to working from home. And I guess we have to recognize that everyone's individual, like you were just saying there, Jack, and you have to ask the individual, look at the individual employees and communicate and find out what is going to work best in all areas. It has to work for the employer, it has to work for the employee as well. But what impact do you think, or have you seen, sort of themes with remote home working on staff wellbeing? It's a very big question. Should we go back to you, Colette? What are your thoughts on that? So what have you seen? We've seen a lot of home workers, haven't we? And our patients that we see for physio are, a lot of them are home working. What sort of trends have you seen? What effect on sort of physical well-being and mental well-being have you seen?
I think it's coming in waves. So at the beginning, we perhaps weren't seeing more necks and backs, which I'd probably say we're seeing now, because I think it was still a novelty for people. They're still working out what they could or couldn't do. I think back in the beginning of the pandemic, it was more about the actual practical side of working from home or remote working. About, can I actually do this? I live in a one-bed apartment, or I live in a shared house. How am I actually, where am I going to work to have this confidential, meeting kind of thing? So it was more about the practicalities. And as time's gone on, we've certainly had waves where we've seen more back and neck pain, and that's often been attributed to, again, working, on a bed or on a sofa or kitchen table, or indeed inactivity. And I'd say as time's going on, it's more the inactivity which people are reporting as the reason for why they may be getting, musculoskeletal aches and pains. The lack of commute. The remote working is great, but you do tend to be more sedentary. There doesn't seem to be a fixed beginning and end of the day. So, people are doing less. I think, the closure of, the swimming pools and the gyms and the team events or individual events, parkrun, I think has been a massive one, actually, because that was something which, a lot of people, regardless of their ability, could do. And it's just those little things, they're just not been able to get out and be more active, or being remote has kind of led them into that sedentary lifestyle. And that seems to be more of a factor. What we're seeing now is, I think this is why I'm getting these various aches and pains.
And we've had found it quite difficult, through this time, because when we look at sort of desk assessments and ergonomics and what the responsibilities are of the employer through this period, initially it was very much, you don't need to do, further desk assessments on home workers because they were saying it's temporary. And I think we found it difficult to actually, draw that line in the sand and go, when is it not temporary anymore? And waiting for the guidance on that. And, employers, we're all doing the best that we can do, aren't we, with the information that we have. But it's definitely, as time has gone on, we've definitely seen a lot of our customers go, actually, we haven't done X, Y, and Z, and now we need to look into that. We're starting to hear reports of neck pain, back pain. So that's been, and I think the way we were assessing people at the beginning, we were like, well, we could make do with this and could use that. And now it's like, do you know what? They need the kit. They just need the standard kit because they're well set up.
But I think even now, companies are still, and I appreciate this is one thing which which you're asking companies to do. There's been so much that they've had to do, and this might not be on the highest of their list of priorities. But I still see clients now who, throughout all this time, have still not had even a self desk assessment, or even aware that something like this even exists. So again, it's been quite amazing at times where you've had, oh, so have you had a self-assessment, or anyone asked you? Nope, nothing at all. Oh, okay.
And it is still the employee's legal duty to risk assess the employee's place of work, wherever that may be. Even if they went onto a site for a day or half a day, it's still the employer's duty to risk assess. So I think kind of using this is temporary argument just can't sit really.
No, I agree. It's duty of care, and I think it's that education still of employers and employees that they do have this duty of care to do this, but also encouraging employees to actually ask. Please, may I have an assessment? I'm not functioning well in this environment. I believe there's something out there which can help me. So we certainly encourage people to have that communication, like Jack spoke about at the very beginning. Employers and employees talking with each other and keeping those lines of communication open.
Jack, what from your perspective, sort of from Champion Health, mental health, what have you guys? I'm guessing you guys have some fancy data, perhaps. Of what are you seeing on the scene with these remote home workers?
Yeah, there's so much that I feel this could be a whole hour just talking about this part. There's so many things. I'm like, I need to write these down before I forget them. But there was a recent study, and I can't remember exactly which one, but I'll dig it out at some point. But said 49% of workers said they would leave their job if they weren't able to work from home going forward, which is just interesting, right? So that shows how important it is to a very large part of the working community. But the interesting thing for me, looking at it from a former wellbeing lead aspect and writing strategies and how do we support our people, is pandemic work from home and pandemic working is very different to work from home normally. So when we're talking about that commute, and instead at home, when we first went into this, you're just going straight onto the laptop. On average, we're working 2 hours extra a day. On the whole globe, that's the average. But that was because you're also restricted in what you can do. We say about social connection being an issue, but when you can't go out and do things, of course it's an issue. Yes, you get a social connection with work, but if we are back to whatever we love to talk about, this normality, whatever that is, if we just went back to previous and work from home, it's a very different experience to doing it within a lockdown. So I think if you're looking forward and you're writing a strategy and you're making these plans to support your people, there needs to be almost two different parts to this. Here's a COVID response, and here is moving forward for hopefully a much easier future where there's a bit more freedom, because it's a completely different thing to plan for.
And there are, right in thinking, there are some people that would like to just work from home full time, ongoing as their new normal. There are some people that would rather just be in the office full time as their new normal, and then there are these people that want the mix, right? So if you were saying to people, actually, you're going to be working from home for 3 days and in the office 2 days, like what effect do you think working from home is having on mental health? Like what things have you sort of seen reported?
Yeah, as we know, mental health's gone up, but that's not just from work from home, as we know. So that can't take this huge blame on this. So that's one of those where, yes, it will have some element of it, but it's not the main reason why people are struggling at this time. But I think it's, as Colette said, this is around the resources we're providing, the education and knowledge that we provide, so that people have those habits and those good behaviours and that access to what they need to be able to create a good working environment. The first however many months of lockdown, where it was that temporary, it's working in my bedroom on a rubbish desk and having neck issues myself because I haven't got it all set up, compared to now where, you know, transform one of the rooms into this, and I'm lucky to have that opportunity. So it's, for me, it is hugely about awareness. We know that with mental health and wellbeing, awareness and education, as Colette said, to be able to, if people are going to have to work from home, let's make it the best environment possible. And yeah, as Venya said, it's a point of, this is a responsibility of the organisation as well to provide this. So
any thoughts, Abena, on what's been said?
So the impact that working from home has had on, are you talking specifically mental health, well-being?
Well-being, just general, yeah.
Sorry?
Just general.
I mean, so I'd say the things I've personally come across, you know, when lockdown has eased, is that there are a lot more people who have reported feeling, these are the people that feel like they've been forced to work at home and they prefer to actually be in the office. So there are a lot of people who have felt otherwise isolated. Seen a somewhat increase in pre-existing addictions getting worse. So that could be alcohol, drugs, smoking, because it's just easier to hide when you're not actually socializing and getting out and in the office. And those are kind of very easy, accessible forms of distraction. And then just the stress from, I know it's stressful being in an office. It's also stressful being out of the office in whatever other environment you are. So most people are at home. And when you're at home, usually there's other people at home with you that are either distracting you or there's things that need to get done. And that can be really stressful. And it's also become apparent that not many people are as digitally savvy as you might think. So trying to get used to the whole setup and using it regularly, as well as getting distractions on your laptop, as well as behind you or in the next room, and a child knocking on your door, or your husband knocking on your door, and it's quite a lot for people. I mean, those are the downsides, but like as Jack said, like it is about looking at a strategy moving forward, an overarching strategy, speaking to your people, seeing what they want, and I'm sure people want different things, but putting something in place where there should be more autonomy and say and flexibility, because at the end of the day, if that translates to great business outcomes, that will also translate to great retention, greater well-being, etc., etc. So yeah, that's my thoughts in a nutshell. I mean, there's also really great positive things about working from home, as we all know, but you know, with everything there's risks and benefits with everything. So
that sort of leads me to my next question around, you know, do people actually want to return to the office, or like what, you know, how are you seeing any particular trends to like who wants to stay at home, who wants to go in the office? Like what you know, you talked about the benefits of working from home as well. Do you think people want to return to the office? Is there anxieties about returning to the office? Like what have you seen from a medical kind of health perspective?
The thing is, what I see in OH is very skewed, in the sense that it's just people that, you know, when things go wrong, or they're going wrong, or there's some kind of dispute. So I'm probably not the best person to ask from a statistical perspective, but I mean, I've seen both sides of the coin where, you know, you have people that do want to go back and are quite keen to go back, but have concerns about how their health might be affected, or have suffered from health problems whilst off and coming back and need that additional support, and vice versa. People are forced to come back and they don't actually want to, because, you know, working from home was that much more better, or they've got caring responsibilities, or they've got something else. So again, you just see both sides of the coin. I think it depends on the business. It depends on how close people work from home, so that with the commute, there's still a concern even now about public transport and catching, you know, COVID on commuting to work. So a lot more people might have chosen to drive. Driving could take longer, especially if you're in one of those built up areas. so yeah, it depends on who you're polling. I think which populations you're polling as to whether people want to go back or not. But I think it's quite mixed. I think people are more keen to actually get out and maybe socialize, and the benefit of being in the office is the main thing, seeing people. But the flexibility, I think people have found really beneficial. I mean, I personally find it really beneficial, but that's just my personal circumstance. And actually, I came from, working essentially quite well fitted from working from home in occupational health. So it wasn't that much of a kind of significant transition for me, but I know for a lot of other people it would have been.
And you mentioned there about being forced to go back to the office, and I think that's quite an important word, because like you were saying, Jack, it's about the communication and almost having this conversation. So I guess if someone feels that they've been forced, then something's gone, potentially that could have been eased rather than, they've had a conversation perhaps. What do you think, Jack?
And anxiety's gone through the roof. And it's only growing even more. And as was said, it's not just about the workplace and making sure that the workplace is safe, secure, and people are happy to work there, but you can't control everything on the way to the workplace as well. And for me, it's we keep going back to that individual, and some people might not agree with this, but it's around trust for me. So if I employ someone, I've pretty much done my research, and I'm at a point where I trust them. That's why I've employed them. So why then am I treating them like children and not valuing their opinion and their knowledge and their experience? I employed them for a reason. If they need to work at home, I can trust them to work at home. If they need to come in, whatever they need to do. And yeah, you don't, for me, it's about losing trust. It's not about earning trust. If you're recruiting properly and if you're employing the right people, it shouldn't be a problem at all. So that's the autonomy piece. And there is no better way than to bring value, bring buy-in to your organization, and giving people autonomy, treating them like adults. And that's the beauty of working from home. When you have that autonomy, you can go and do things and sort things and look after yourself. I appreciate it's not the same for everyone. You might be living with 7 different people in a house in London and not able to get good internet or whatever it might be, and all these other caring responsibilities. But yeah, straight back to that trust thing and unfortunately all my answers are going to be around the individual, because it is very much that, and that is well-being. It's individual. But if you trust your people, let them be the individuals that they are. And if we're taking it then back to performance every single time, if someone works better at home, let them work at home. If someone works better in the office, let them work in the office. Because that's what would bring it back to on well-being, is the business case and the return on investment. So if performance is there and they are thriving in that and they're happy to do that, they're not doing it in an unhealthy way, then let's just trust them and let them get on with it.
But Jack, what would you say about teams versus individuals?
Yeah, so that, I think that changes in terms of if you are in an organisation or a sector where you need collaboration, you need that creativity, then you need to have that happen. Now, that's the difficult part of, is it forcing, or, so that's a conversation with your team. And are there ways we can get around this? Are there ways where we do feel that we have that ability to be on a Teams call, a Zoom call, and we're able to get the creativity there? Or maybe we'll do it outside. We'll have that meeting outside, right? People might feel better outside doing it. So it's just, to get creativity, be creative first. So yeah, obviously it's going to be a huge challenge for people, and you're completely right, because many of us will be much better in a team. My ideas are always much better when I'm with someone else, because they'll actually question me instead of me rambling on as I like to do right now. So I completely agree. But yeah, get creative.
Because I've heard a lot about like Zoom burnout or video conference burnout, where people are in meetings all day but on a computer. I mean, it's worse than doing it face to face in many ways. But yeah, I mean, you've got the individuals, and the team is a bit, as you said, is a bit more tricky, because it's not just collaborative. It's just actually just having people around you that you can. I mean, people have Slack, right? But it's just not the same as actually having people in the same room, and sharing ideas on an almost ad hoc basis. And sometimes, you have managers that say we really need people in the office for that purpose. And when you've got like the one person or even 2 people out of 6 away, then it can really affect the team dynamics. And then whose responsibility is it to make the decision as to whether they mandate home working or not? It's always going to be really tricky.
That then comes down to the data you're using and the reason you're using, if it is that force. So if I'm saying it's come in because we're going to be more collaborative and we're going to be more creative as a group, show me that. Show me the evidence, then I'm more likely to come in, right? Now, I appreciate that's a really difficult thing. I'm not going to be able to answer how you find that data or how you put it together, but you have to show that it's not just what I believe this as an individual.
And
well, give me the reason why.
Yeah, and I think when I've been talking to clients and just to friends and family, whatever else, I've not really heard that many people say, "Gosh, our productivity is really dropped because we're not all in the same place." What I do hear time and time again is, "I really miss walking over to my colleague's desk and having a chat," or "I really miss saying hi, to the guy who serves me my coffee in the morning." It's those everyday social interactions which just aren't there at the moment, and they seem to be more telling in how people feel and how they are, as opposed to I can't get my team together in a room. I have a friend who heads up a big team in a big London global company, and I think they've met a couple of times in a coffee shop just to say hi, hello, I'm a real person, this is who I am. But actually the majority of the time they've continued on the screen. And it does seem to be, with working from home, I think often the thing which people work hardest at is actually stopping that sense of loneliness. And I think that might be, an important factor to consider as well. Wherever you may work, offices aren't going to be as busy at the moment if they choose to go in, particularly if you're, putting teams on rotas, obviously working from home, depending on who's there. So it does seem to be about those day-to-day social interactions, which people seem to miss the most.
I've got just a couple of thoughts. I mean, we're looking at this from like a health and wellbeing perspective, because that's where we all work. And we're talking about communication and individuals. But how do employers navigate this? Because they have to make it fair, don't they? They have to. Yes, there's some autonomy and trust, and maybe let line managers make individual decisions based on communicating with their team. But there has to be some kind of fairness, doesn't there, across the workforce. And Bailey, you touched on hybrid working is an extension of flexible working, and obviously we talked previously about like flexible working policies and things like that. So how do employees navigate it, this return to the office, this hybrid working? Anyone got any thoughts on how they do this? Is it about policy? Is it how do they communicate?
There's so many factors. What's the rental agreement on your office space? That might be a massive thing to a lot of people. We've got a 6-month bit where we can get out. This could be the moment where we save our company an awful lot of money. Or they may be tied to a rental agreement, and I think that's then going to really bias how their communications are going to be. I think there's so many factors. I think Jack alluded to earlier, that business culture as well. Have they always had that we're going to talk to our employees, or have they always been my way or no way? And I think the cultures are obviously extremely difficult to change, and the pandemic has made that happen because it's had to, but actually doesn't mean that it's deeply changed. It's just that tip of the iceberg thing again. So gosh, I wouldn't even know where to start. I think there's so many factors involved. I think on the HR side of things as well, the legality of from having contracts which now mean you work from home, they're going to need rewriting. There's just so many different things. I wouldn't know where to start.
And Jack, you mentioned about the data and talking to the staff, talking to employees. How have you seen that work quite well? You said don't overcomplicate it, make it easy. Like, have you seen any examples of how that can be done? Is that something that Champion Health look at all, sort of screening the workforce and what the needs are? And
yeah, so we measure all areas of wellbeing when we do our like initial health assessment with every employee that goes through our platform, and very fortunate to work with some massive companies in all different sectors. So we get a very wide ranging kind of experience, but the main thing it comes back to is that human element around, and it's that culture and that communication. Is having that authenticity in the decisions that you're making, and that it is for the best of what with the data that you have. So we'll ask people outside of the workplace as well, what are the stresses that are affecting them? And we'll ask about within work, what are those stresses, whether that's workload, senior staff members, whatever it might be. Outside might be caring responsibilities. So we can get that information to help an organisation go, well, hold on, we've got a large amount of people here who at home have caring responsibilities. Now, we've made them work at home for the last 12, 18 months. So not only are they working full-time jobs, but they're caring for someone as well. So how do we then support them? So it's not as big as just, cool, this is how we work. It's being able to find out all of that information that you can put in processes in play. I always used to say my responsibility as a wellbeing lead was to have the water and guide the horse to it. It's not my job to make them drink, but I need to make them aware of what we have, and I need to have that ready for them, whether they need it at that exact moment or not. And that's no different. Find out the data, find out what your people need, provide that, and then hopefully you'll have a solution that can help as many people as possible. You're never going to help everyone perfectly. That's unrealistic, but hopefully from those conversations, having that data, you can then help what your people need specifically.
Perfect, thank you. And we've talked a lot about individuals, haven't we? I'm going to come back to you, Wellbeing, actually, around sort of those with disabilities and health conditions, because I'm guessing that, you say you've got a slightly skewed kind of view of how you see things, because you're seeing people that are referring to occupational health. So what type of things would you say get referred to you? And like, there's got to be some individual assessment of these people that, that they don't fit the, everyone's doing 2 days in the office, 3 days at home, but actually they've got a disability. So maybe something's been exaggerated through working from home, through lockdown, or there's been changes in their health. Like how would an employer navigate that? Big questions, lots of questions.
Sorry, ask the question again. Sorry, what?
Just around those with disabilities or like long-term health conditions that are maybe, struggling to enter into a hybrid working model. So say, I don't know, it could work both ways, but I'm thinking more of, they're enjoying working from home, they're managing their disability much better, or a long-term health condition. I don't know, they've got fibromyalgia, they've got chronic pain, they can't walk very far, but actually they maintain things really nicely at home. They can do all their techniques, whatever, but they still get the work done. The productivity is there, as Jack was saying, what the performance indicators. But then the employer's like, no, actually everyone's going back 2 days in the office, 3 days from home. That's what the blanket is fair. That's what everyone's doing. It's a decision we've made. But then that person, is feeling they can't do it. What would an employer do in that situation, do you think? And are you seeing much of that, or?
I guess it varies. I mean, just looking at that particular hypothetical situation, for anyone with a disability or a health need that is better supported at home, like employers are legally obliged to at least consider that as an adjustment. Flexible working has never been a kind of a right. I mean, it's an option that should definitely be considered and explored, but we know there's nowhere in law where an employer is forced to offer a disabled person a certain adjustment. But it needs to be seen, whatever adjustment is put in place, it needs to be seen as reasonable. Reasonability being that, it's something that could actually be supported without too many issues for the employer and vice versa. And that is quite a grey, nuanced area in itself. But for those with disabilities, I mean, again, it's about having that conversation with their employer, having a fit for purpose assessment. So being fit for purpose is the employer does their risk assessment, and then if necessary, they get specialist advice, whether that's from occupational health or any specialist workplace practitioner, like such as yourselves, or the right one, basically, to get the right advice is to see what are the best adjustments for that particular person in their particular situation. I have seen, particularly towards the end of last year, I have seen quite a few cases where you kind of question whether employers are using this as an opportunity to manage out that individual from the workplace. I can see in a better way, but I did see quite a few cases whereby you have someone who's had a long-term health condition, they've been off on furlough, and then coming back to the workplace, the employer kind of didn't really want them back, or they kind of put up a lot of really high boundaries for them to actually come back, or obstacles for them to come back, which was a bit unnerving. And this was just my interpretation of what was going on. I don't know actually what was going on. Sometimes you just never know, but that was an issue then. But yeah, now I haven't seen it. I mean, I haven't seen as much at this time with regards to people with disabilities. So actually saying that, I've seen some circumstances whereby an adjustment of working from home has been introduced, either because of the pandemic or for other reasons, and then now it's no longer sustainable for X, Y, and Z reasons, for business reasons. And that can be quite a sticking point, because if you step back, you say, well, actually they could still do that job from home. Like, what are the business reasons? And sometimes it's just so kind of out of anyone's control, because it's a decision that's been made like hierarchies away from you. It's quite difficult to really understand the reasoning behind it, especially I'm talking about really big organizations. So yeah, but I mean, it always comes down to making sure that conversation is had, make sure a risk assessment is done, and then a specialist advice is basically retrieved from occupational health or a specialist workplace practitioner.
And document everything. Yeah, that's interesting about like Disability and Equality Act and things like that, because I guess if people have been working from home for the last year, however long, and it's been working fine, productivity's been fine, there's been no performance issues, management issues, and then they're now saying, no, you can't do that anymore. But then they say, well, I've got a disability, I want to continue working from home. The business says no. As you say, you have to have that business justification of why it wasn't a reasonable adjustment if they've already been working from home for a year and there were no issues. So it's going to be an interesting time. And I think when the furlough scheme comes to an end and people are coming back into the workplace, I think we've personally felt, haven't we, Claire, that's going to uncover a few things as well from our.
I was going to say, I mean, so going on that, I mean, I always advise employers, like, if you're looking at worst case scenario, and the worst case scenario is usually employment tribunal, someone loses their job and they take up a legal dispute, like they really need to justify what was reasonable to them. And if you've got someone who's got a disability and was unable to come back to work because that arrangement wasn't upheld or continued, then they haven't really, and they've demonstrated they can work in that environment for a period of time. We're living in a time whereby it's very much pro-disability, pro-equality, keeping and supporting disabled employees or those with long-term mental health or health conditions at work. I think there wouldn't be much of a leg to stand on. You know what I mean? Like, you'd really have to be pushing it to find a reason why you can justify supporting that person to continue with that, if you call it an adjustment, but essentially it's still flexible hybrid working. So and pretty easy to do, but it's already in place, even though it was something that was introduced as part of the pandemic. But I would say I don't see that many of those cases. Most employers, if they're like, well, they're working well and they're at home and they're doing well, let's just continue that arrangement. So
there's been such a shift, isn't there?
Yeah.
Claire or Jack, have you got any other sort of thoughts on things we've just spoken about? Anyone want to add anything in? Time to silence. All good?
The only thing I'd add is I suppose the uncertainty. Even now, a lot of employees, a lot of employers are still uncertain about how hybrid work is going to work. Again, I hear that dates are being pushed back or changed time and time again. And as Jack and Rabina mentioned, anxiety is just rising all the time, and that's going to be a big part of it. Just that complete uncertainty about not only working or what kind of working environment they're going to be working in, but also when that's going to happen. And that seems to be really challenging. I think what we've also seen is that for those who work in more public settings, so who have been at work, throughout their time, so our supermarkets, our banks, our places like that, there's anxiety or concerns around the COVID safety measures being withdrawn or changed, and again, the plastic barriers and things like that, and the masks, and that again has led to anxiety and concerns within the workforce. Again, about if it is taken away, but then also the uncertainty about when and who and how's that decision being made? Are we involved? What are they basing it on? Does it mean it's going to come back? So I think that's got a massive part to play in how people are feeling right now.
Perfect, thank you very much. That's our 45 minutes of discussion up, and so thank you so much to the panelists. Does any of the attendees have any thoughts or questions? You can use the chat function, or it's quite a small group. You're very welcome to unmute yourself if you've got any thoughts or any questions, or are you currently delivering a hybrid working model, or thinking about it, or experienced it? I know we've got some other health professionals in here as well. Has anyone got any questions for us? Just give me a minute there. If not, what I will do is I will send the recording over to everybody who has signed up to the event. So I'll send through the recording, and I'll CC in so Jack there from Champion Health, and Abena from Wellbeing Quarter, and Colette from Bespoke Wellbeing. So if you guys have any questions, feel free just to reply to us and just let us know. We're really happy to help you there. But otherwise, I want to thank the panelists so much for their time this afternoon, and thank you to everyone who has come along and joined us for our first event. Very exciting for us, and we will put some more on, and we'll let you know when they are, and hopefully you will come and join us again. So thank you ever so much.